While it's not often talked about, a new study links chronic constipation in women to a higher risk of heart disease. The study, which appeared in the American Journal of Medicine, followed 73,000 women between 6 to 10 years. Overall, 35% had constipation and were more likely than other women to develop clogged arteries, have a heart attack or stroke, or die of heart disease. The specialists at Advanced Gastroenterology and Surgery Associates explain how chronic constipation may be a symptom of something more serious.
Irritable bowel syndrome is a chronic condition, and it's the most common reason that we actually see a lot of patients, maybe outside of acid reflux. The one good thing about irritable bowel syndrome that I tell patients is that it won't kill you, and it's actually, in the past, we called it a diagnosis of exclusion. However, now there are sort of definitive parameters. You can actually make a diagnosis just based on the patient's symptoms. If someone has chronic abdominal pain associated with changes in bowel habits, and it's been going on at least 3 times for the past 6 months to a year, then you can, by what's called the Rome criteria, diagnose them with irritable bowel syndrome. Now, of course, these are patients without warning signs, meaning no weight loss, no poor appetite, no blood in the stool. And it can be divided into diarrhea predominant, meaning that the patients mainly have diarrheal symptoms, or they can be constipation predominant, where patients have mainly constipation, or you can have both, alternating constipation and diarrhea. But it has to be abdominal pain associated with changes in bowel movements. And then, if everything else is there are no other warning signs, then you can make the diagnosis of irritable bowel syndrome. It's lifelong. And there are many medications out there that we use to try to control the symptoms, but there's nothing really curable. Since the advent of the probiotics, they have helped a lot in controlling a lot of symptoms, especially in someone who we think there was a triggering factor from a virus or antibiotics. We know that the colonic bacteria is very important, so replenishing the good bacteria in the colon is crucial.
When constipation slows you down, the doctors recommend the 3 F's of digestion: fiber, fluid, and fitness. We need about 21 to 38 grams of fiber a day to keep the colon speeding waste through the system. Most Americans get about 11 grams. High fiber foods include vegetables, whole grain breads, legumes, and fruits. Dehydration plays havoc with our body functions, including hindering digestion and elimination. Aim for 10 8-ounce glasses of water a day. Exercise accelerates movement through your intestinal tract and prevents excessive absorption. Even just a walk daily will help. For more information on the specialist at Advanced Gastroenterology and Surgery Associates, with offices in the Villages, Leesburg, and Claremont, please follow the Chronic Constipation Story link icon on our homepage, yourhometownhealth.com.